Welcome to Imaging at Olympic Park. This new state-of-the-art medical imaging and treatment facility has been optimized for diagnosing and treating conditions of the musculoskeletal system. This video will briefly explain what we do for an ultrasound-guided injection of hyaluronic acid or Synvisc. What we do. There are many ways to treat conditions of the musculoskeletal system. Your doctor has recommended an injection of hyaluronic acid. This is a common treatment for early osteoarthritis of the shoulder, hip, knee, and small joints of the hand and foot. Hyaluronic acid acts as a lubricant for joints that have worn away the articular cartilage, allowing the surfaces to glide over each other freely. This reduces the friction and thereby improves function and relieves pain. Why we do it? Firstly, a diagnostic ultrasound will confirm your doctor's suspicion of a joint disorder, assess the severity, and exclude other causes. Secondly, we use ultrasound to guide the needle tip inside the joint. Precise delivery of hyaluronic acid into a joint will maximize its effect and avoid any potential complications. How we do it? Our sonographer or nurse will call you through to the ultrasound section of the department, where you may be asked to change into a gown depending on the type of procedure. Our nurse will ask some questions regarding your medical history, discuss the small risks and possible complications. Complications of an ultrasound-guided hyaluronic acid injection are uncommon, but do include bruising, infection, and local soft tissue injury. Sometimes patients report pain and discomfort after the injection, and this can take several days to resolve. You may treat the injection site with ice or take paracetamol as necessary. You will be asked to sign a consent form. An ultrasound is a safe and painless exam. The sonographer will place a small quantity of ultrasound gel on the skin. He will then scan the area of concern by applying light pressure to the region of clinical concern. A doctor trained in ultrasound-guided injections will be called upon to perform the injection in a safe and careful way. He will select the needle size, quality of hyaluronic acid, and the manner in which to perform the injection. The injection will almost always involve the administration of local anesthetic. The injection typically involves penetrating the skin with the needle, and there is a stinging sensation as the local anesthetic is injected. It will take a minute or two for the local anesthetic to work. The hyaluronic acid is then injected. Infection control is important to us, and we make sure the procedure is done with a sterile technique. Our facility and technique are compliant with and have been approved by the Department of Health Services. After my injection. After the injection, you'll be asked to remain in the department for a minimum of 15 minutes. You'll be given a drink and something to eat. It is recommended that patients rest comfortably for the rest of the day and not engage in physical activity for the following 48 hours. The local anesthetic can last for up to 8 hours. Patients often feel numbness or heaviness around the injection site. When the anesthetic wears off, there may be some regional pain and soft tissue swelling. The hyaluronic acid injection typically takes several weeks to work, and you may be asked to return for more injections. It is also important to follow up your doctor's instructions regarding your rehabilitation program. Complications are uncommon, but should they occur, please contact Imaging at Olympic Park, your referring doctor or general practitioner. Thank you for attending Imaging at Olympic Park. We hope your ultrasound-guided injection is successful. Remember, if you have any questions, please don't hesitate to ask.